Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University, with a joint faculty appointment at Ross University School of Medicine. I wanted to draw one of the maps from actually the County Health Rankings 2022 from the Living Atlas, which has been recently added onto ArcGIS, and I wanted to make note of that. I was excited to find out that this was actually included as part of the geospatial maps. Anyway, so taking a look, you can look at the legend here, and when you see that some of the darker counties, that's where the highest percentage of fair or poor health is. And so if you look into all of the areas with fair and poor health, Appalachia areas, high fair and poor percent, and then Atlanta, all of these areas, Alabama, Louisiana, all of these areas of poor fair health. Now, Los Angeles is an area as well. So looking through this, it's interesting to see, but there's a lot more that you can do with this. A lot more variables that you can look at. So let's go over to the variables. So in this tutorial, you can see, for instance, properties, styles, and here you can see already all the different categories that are out there that you can draw variables from. So percent 65 and older, percent adult obesity, percent adult smoking, and I'm not going to read the list all the way through, but percent children eligible for free or reduced price lunch, percent children in poverty, and this is broken down, children in poverty by race, ethnicity, and then percent diabetes prevalence, percent driving alone to work. Now this, I believe, is a new variable. This is interesting because when you actually carpool, that's less pollution, less burning of carbon emissions and greenhouse gases. Now driving alone, a lot of this, what I'm seeing, the trend in the 2022 county health rankings, the most recent one, versus the earlier ones, is that a lot of these are broken down by ethnicity. And you know what that allows you to do is provide a breakdown of ethnicity by variables. So you have percent excessive drinking, which was there before, but the percent flu vaccinations, I believe, was not broken down by race. Percent high school completion, percent high school graduation. Now looking at percent low birth weight, that's broken down by race. Percent mammography is broken down by race, which is interesting. And then there seems to be also more categories in terms of race and ethnicity. Now looking at poor mental health, that was there. Poor physical health. Percent of children that live in a household headed by a single parent. Now this is interesting. Percent of children under age 19 without health insurance. That's an interesting one. I don't remember ever seeing that variable in the previous iterations of the county health rankings. Percent of driving deaths with alcohol involvement. Percent of households that spend 50% or more of their household income on housing. I think that was still there. housing problems, overcrowding, not sure if that was there. Lack of kitchen or plumbing facilities, definitely something new. There's what is it? Something additional that I'm seeing is that these variables are a lot more descriptive and a lot more well thought out. So, for instance, percent of population who are low income and do not live close to a grocery store, which I think was previously there, but is combining multiples. This one's an interesting one. 2% of teens and young adults ages 16 to 19 who are neither working nor in school. So that's looking at that transition gap, trying to ensure that young adults are in fact active after they graduate from high school. So this also looks at adults in different age groups with post-secondary education. And then you have child mortality per 100,000 broken down by race. What is brand new here, and I can say this, is the COVID-19 age-adjusted mortality. This is brand new. Crude suicide rate per 100,000, firearm fatalities. This was there in previous iterations. Gender pay gap presented as cents on the dollar. I don't remember that. I don't think gender pay gap was even in the previous ones. HIV prevalence was there. And I'm actually looking at this for the first time as I'm doing this tutorial. So you'll see me doing a lot of searching because I'm going back in my mind to think if this was in the previous iterations to see what's new. But I'm going off of memory, so I might not be 100% accurate in this walkthrough. And if you hear that noise, that's actually my fan that heats up from time to time. Anyway, looking at infant mortality, for instance, black infant mortality is well known to be disproportionately higher than in other races. So it's good to look at that value and also look at infant mortality in other races as well. Now the life expectancy also is something interesting to vary by ethnicity. Also, the living wage is something that's not just the wage that you earn, but it's what you're working off of. Looking at math scores, mental health providers, this was all there, motor vehicle accidents, a number of poor physical days, mental health days, number of children eligible for free or reduced price lunch numerator. Now this is interesting, number of drug poisoning deaths, and this is broken down by ethnicity. I'm pretty sure this was not there. Another one that's new is a number of households in a county with broadband internet subscriptions, such as cable, DSL, or fiber optic. And this would show something called digital redlining. Housing problems, this is interesting. What is even more interesting is number of informally handled juvenile delinquency cases per 1,000. Juvenile delinquency cases. This is new. This is brand new. I've never seen this, but it's interesting because it is a testament of not only the criminal justice system, but how our youth oftentimes are through have to be placed through delinquency centers. Also looking at number of Medicare beneficiaries enrolled in fee-for-service Medicare Part B, at least 1 month of the selected year, and who have received a covered influenza vaccine in the last year. So this is a lot of things included in one. It's not just looking at the percent that that took the influenza. So looking at those that were insured, those that had Medicare, how much of them got the influenza vaccine. I think that's a long one, and long variables were not there in the previous months. A lot of this is still ones that seem familiar. Number of violent crimes, number of white deaths due to injury per 100,000, number of women who had mammogram, PCPs per 100,000, premature age-adjusted mortality, broken down by ethnicity. Another one is premature death, broken down by ethnicity. Preventable hospital stays, I don't remember that, broken down by ethnicity. I think that's a new one. Again, rate of delinquency cases, juvenile delinquency. That's a brand new one. Of course, residential segregation was there, but this school funding adequacy gap, this is actually a brand new one, and is interesting to look at. I'll probably make a video on that one in some of the next segments. Again, school segregation index, that is a good composite measure. Sexually transmitted infections, suicides, teen births, and that's broken down by ethnicity. I'm not sure that was there before. Looking at total deaths for infants under 1 year of age, total female Medicare beneficiaries, total number of live births, so there's a lot of total at the end, and which you may or may not be interested in, but I think this is just summing this up. I know some of this is just blank gaps that you'll find, and I just wanted to keep this to have a natural pace, a flow when I'm talking. So just go through this list and just play around with this. Put some variables in, plug in some variables. It's been added very newly because I was just here a month ago. It wasn't there. So just go in and start fiddling around with some of these and see what you come up with. And if you have any questions, you can post on my YouTube channel. Thank you for listening.